Hi, my name is Karen Nicole de la Cruz. My student number is 187-39116, and this is my oral presentation for Health Variation 3. This presentation is about the case study of Mrs. Manalo, who is 65 years old female, diagnosed with atrial fibrillation and later developed embolic stroke. This presentation will cover the A2E assessment findings for Mrs. Manalo, followed by 4 high priorities nursing intervention and 3 prescribed medication with nursing consideration. To begin with question 1, I will discuss the A2E assessment for Mrs. Manalo. Starting with her airway. Mrs. Manalo's airway is reported to be patent. However, her GCU score is sub out of 15, and she is experiencing slurred speech. According to Saver and Hankey 2021, maintaining airway in stroke patients is the highest priority due to the likelihood of blockage caused by impaired consciousness and protective reaction. Hypoxia induced brain damage can be prevented by keeping the airway intact. Therefore, it is critical to have continuous monitoring and be prepared to escalate. Breathing. Mrs. Manalo's oxygen saturation is at 95%. According to Brady et al. 2022, although this is normal, it is still necessary to do oxygen therapy to ensure optimal oxygen delivery to the brain. Mrs. Manalo has shallow respiratory rate of 26 breaths per minute. Increased respiratory rate indicates tachypnea, which may occur in response to pain, anxiety, hypoxia, or early respiratory distress. Mrs. Manalo's shallow breathing indicate less air per breath, which can lead to inadequate ventilation. Atelectasis or early pulmonary complication may happen in stroke patients like Mrs. Manalo. Therefore, thorough respiratory monitoring and physiotherapy are crucial to lower the risk of respiratory failure from immobility and aspiration. Circulation. Mrs. Manalo has a tachycardic heart rate at 132 beats per minute and a blood pressure of 170 over 95. Mrs. Manalo's vital signs imply a stimulating of sympathetic nervous system, which could be the effect of stroke acute stress response or an underlying atrial fibrillation. According to Kraft et al. 2023, peripheral coldness and pitting edema imply insufficient circulation in the extremities and potential hypervolemia. Capillary refill of less than 3 seconds present adequate perfusion. Blood pressure management is important because severe blood pressure drops can decrease cerebral blood flow, and elevated blood pressure can increase the risk of cerebral edema. That is why effective blood pressure management is and regular cardiovascular monitoring are very crucial. Disability. Mrs. Manalo's neurological assessment indicates a Glasgow Coma Scale or GCS of 12, with slurred speech, left sided muscle weakness, and facial droop, in line with signs of an embolic stroke that damaged the right cerebral hemisphere. Mrs. Manalo's pupils are equal and reactive to light, indicating cranial nerve function is still intact. According to Rubin, Clauda, and Lee, 2024, the presence of neurological deficits helps the prioritization of urgent stroke team review and assessment for Mrs. Manalo's thrombolysis eligibility. Ongoing neurological assessment and urgent stroke management are vital to observe deterioration on Mrs. Manalo's condition. Exposure. Mrs. Manalo is reported to be afebrile. This means that her deterioration is not caused by her either infection or trauma. According to Hossein Saida 2025, fever can imply cerebral injury and worsen neurological outcome as a result. Maintaining normal body temperature is critical in stroke management. Mrs. Manalo has nerve wounds or bleeding noticed. She has intravenous cannula at left cubital fossa, allowing immediate administration of medication and fluids. Maintaining patient dignity and avoiding hyperthermia is also critical. Moving on to question 2, I will now address the four nursing intervention that have the highest priority in managing Mrs. Manalo's embolic stroke as well as their rationale. Number 1. Maintain airway patency. The first priority intervention is maintaining airway patency and optimize oxygenation. According to Kaplan and Agarwal 2023, dysphagia and loss of consciousness heighten the risk of aspiration airway and airway obstruction. In relation to Mrs. Manalo's case, she must be in a semi to high Fowler's position to be able to achieve sufficient air circulation as well as to minimize the risk of aspiration. Adequate oxygenation reduces the risk of cerebral hypoxia and serious brain damage. For this reason, Mrs. Manalo should continue wearing a Hudson mask to keep her oxygen saturation above 95%. Prepare to initiate an escalation if her GCS drops or her airway gets blocked. Neurological monitoring. Number two is the frequent neurological monitoring and fast assessment. According to Radak and Juvnak 2025, stroke patients like Mrs. Manalo needs a regular assessment of speech, pupil response, limb strength, and GCS. It aids in the detection of impairments of complication such as cerebral edema or recurrent thromboembolic complication. Early detection of deterioration improves patient health outcomes. And if Mrs. Manalo GCS continues to drop, prepare for immediate escalation. Blood pressure monitoring and management. Hypertension is mostly occurring after an embolic stroke and it can end up to poor health outcomes, including recurrent stroke, dependency, and death. It occurs in 75 of patients after stroke to preserve the cerebral perfusion pressure. Therefore, the first 48 hours after stroke onset must be monitored thoroughly. Nurses should also identify the underlying causes of hypertension for Mrs. Manalo, like vomiting, discomfort, as well as urine retention. Number 4. Complication prevention. Mrs. Manalo's left sided paralysis increases the risk of pressure injuries and venous thrombosis. It is necessary to reposition her frequently to prevent pressure injuries. Thorough skin assessment to enhance skin integrity, and maintain correct body alignment with pillows to promote blood circulation. According to Kaplan and Agarwal 2023, early physiotherapy significantly improved patients' mobility, outcome, and support independency. Question 3. I will be discussing the medication which I chosen are IV alteplase, heparin IV infusion, and metoprolol 50 mg BD. Heparin sodium is an anticoagulant, works by preventing clot from forming, but it does not remove blood clots. Prior to giving Mrs. Manalo a heparin infusion, nurse must conduct critical evaluation, including assessing her bleeding risk as well as confirming that all her blood tests are normal, including PT, APTT, and INRR. INR. Infusion pump must be used to administer heparin. Mrs. Manalo's VIP score should also be checked regularly to ensure patency. It is also important to check the medication aura, examine the IV bag, and verify the infusion. The side effects for this medication is gastrointestinal or urinary tract, while hemorrhage, hyperkalemia, and thrombocytopenia are rare but dangerous side effects. Alteplase. According to Suran 2022, alteplase is drug also called as TPA, tissue plasminogen activator. It is a thrombolytic agent performs through the conversion of plasminogen into plasmin. The purpose of the drug is to dissolve blood cloth and bring back blood flow and oxygen to the brain. To achieve optimal effect and reduce complication, it is necessary to continuously check for bleeding risk and monitor neurological condition. The administration of alteplase should be within 4.5 hours of symptom onset. The side effects are bleeding, fever, nausea, and hypotension. Metoprolol is also known as Lopreso. it is an oral beta blocker. The drug is used to manage blood pressure and heart rate. Before administering the medication, Mrs. Manalo's heart rate and blood pressure must be checked. This medicine should be ceased if Mrs. Manalo has hypotension or if her heart rate drops below 60 beats per minute. The recommended dosage is 50 to 100 milligram twice daily and with food to prevent upset stomach. The side effects are bradycardia, fatigue, lightheadedness, and GI upset. Thank you so much for listening, and these are my references. Thank you. Bye.